everyone, welcome back to Dr. T Kidney MD. Today I want to address a question that I received from a patient yesterday, and that question was, will my kidneys get better? Now I like receiving questions like that from patients because it basically means that they understand that something is wrong with their kidneys and they want to do something to try to improve their situation. So if you have kidney disease and you want to know whether or not your kidneys will get better, my response to that is it depends. Whether your kidneys will get better depends on if you have something called chronic kidney disease or whether or not you have a condition called acute kidney injury. And I'll briefly explain the difference between the two. Chronic kidney disease is a condition in which over time there's been kind of long-term, gradual or slow loss of healthy kidney tissue. And once you lose your healthy kidney tissue, we don't expect to ever get that back. So when you hear the term chronic kidney disease, we're basically saying that you have permanent kidney damage and we don't expect that it's going to get any better. So our job from that point forward is to try to preserve and protect and hold on to the remaining kidney function that you have to nurse you over the rest of your life. Now, acute kidney injury is a condition where you may have a sudden insult to the kidneys, or your kidneys become suddenly weakened, and we really don't know at the time whether or not your kidney function is going to get better. So think about it in a way like, say you get hit in the arm with a baseball. You're at a baseball game, a ball comes flying into the stands, it hits you in the arm, you have this big, red spot and it's bruised, and you don't know whether or not it's going to cause a permanent scar. And that's kind of how acute kidney injury is. You've had this sudden injury to the kidneys where they're weak, and the only way we'll know if they get better is if we can just kind of watch the numbers and watch you over time to see if there's any improvement. Now, not to confuse you, but you can have both conditions. You can have chronic kidney disease, meaning we know you have underlying permanent kidney damage, and on top of that, you can get acute kidney injury, meaning your underlying chronic kidney damage has suddenly become worse, and we don't know whether or not you're going to resume your previous level of function or whether or not the kidneys are going to continue to get worse unless we watch over time. So what do we do for both of those conditions? So for chronic kidney disease, we basically try to protect and preserve the kidneys as best as we can. So for example, if you have high blood pressure or diabetes, and we know that those two conditions can cause long-term loss of kidney function, what we do is control your diabetes and control your blood pressure to, again, try to hold on to what you have. If you have acute kidney injury and we're kind of in limbo, our job at that point is to get rid of whatever the insult was or injury that caused the injury to your kidney in the first place. So for example, if your blood pressure is really low and your kidneys became aggravated, what we would do is try to raise your blood pressure so your kidneys could work a little better. Or if you've taken a medication that can injure the kidneys, like your Motrin, Aleve, those non-steroidal anti-inflammatory drugs, or aspirin-based pain products, those can injure the kidneys. And what we basically do is remove that from the picture to try to help your kidneys get better. So again, to respond to patients when they ask me, will my kidneys get better? The answer to that is, again, it depends, or whether or not you have chronic kidney disease or acute kidney injury. I hope this was helpful. If you thought it was and there's someone else that you feel could benefit from the information, be sure to share this video. If you like the video, make sure you click on the like button. And if you haven't subscribed yet, be sure to subscribe so that whenever I release anything new, you'll get a notification that, there's some more helpful information out there. And again, I hope this was helpful. Thank you, and I guess I'll catch you next time.